identity, the next pillar we touched on fintech, money. But nothing works if you don't have health, right? Everyone says that after you chase all the money after graduating from college, you want to get a good job, high-paying salaries, everything. But at the end of the day, you come down and you say, health is wealth, right? And that brings us to our next panel discussion. It's a very, very special topic, very important discussion, and something which is happening in India and is an example for the rest of the world. We are going to talk about digitizing healthcare for 1 billion plus people in India. And that is what we are going to talk about today. And we have a very special panel for this one. So first on our panel, as a member, I would like to invite Sri Basant Garg. He is the additional CEO of National Health Authority, Government of India. Next, he is the co-founder of Orange Health Labs with a 10-year experience in healthcare as a consultant, investor and a product leader. Can I please invite on stage Mr. Tarun Bhambra, co-founder of Orange Health Labs. Next, we have someone who is the director of postgraduate program in digital health, jointly offered by IIM Raipur and Digital Health Academy. She is a member of the Bureau of International Indian Standards, BIS, Medical Equipment and Hospital Planning Department, and was also the member of the MQM working group of the TEC, Ministry of Information Technology, Government of India. Can you please have on stage Ms. Mevish, Vaishnav. Coming up next is a co-founder and CEO of Cloudphysician, a healthcare company that provides technology-enabled remote ICU management solutions to hospitals. Can you please have on stage Mr. Dhruv Joshi. And finally, for saving the best for the last, he's the founder of Health Parliament and Digital Health Academy. He's a leading public policy expert with vast experience in policy making and with major global initiatives on digital health. A former advisor to the Union Health Minister, Government of India, and he's played a key role in drafting the National Health Policy and the National Education Policy 2020. He was nominated by the World Economic Forum on the Global Agenda Council for Digital Health. He has authored 5 books and the book called Digital Health, Truly Transformation, which is a bestseller. Can we have on stage, sir, please, Professor Rajendra Gupta.
As always, health is last and it's always late. I'm not surprised. But let me tell you, the people in health are the best. And I'll give you a brief snapshot of what triggered digital health. And this is a personal anecdote. I guess in 2013, I don't remember the exact date, it was maybe end July or August, when my that time boss, Dr. Murli Manor Joshi, chairman of the manifesto committee, called me and said, Rajendra, start working. I didn't get what it meant. Then he said, Rajendra, I'm again the chairman of manifesto committee and you have to draft it. So then I realized, okay, good. But the manifesto was all about all sectors that I had draft. Health is something that had worked for almost like more than 25 years by then. So I said, that I'll do in the end. But those who had a chance to read it, my pain point came at drafting the things about technology. And I wrote that line that India is the technology capital of the world, but the fruits of technology have not flown back home. That was across sectors, so Digital India program became our flagship program. But when it comes to health, I wrote 2 things, and this is I think I would like to share, that I'm a firm believer of having policies. And the reason I do that is policies give a direction. So you got the national health policy and the education policy as a part of the manifesto, which our Honorable Prime Minister with his vision implemented. And the second thing is I believe in creating institutions. So when I was creating the National E-Health Authority, which became the National Health Authority in the re-Christian name, a lot of people told that it is the National Institute of Family Welfare is there and the HRC is there. Why you want to create an institution? I said institutions outlive programs. They outlive people's thinking and their likes and dislikes, and they keep delivering. So the reason of National Health Authority, that time I had thought about the name of National E-Health Authority. And I think in the past few years, we had 3 CEOs. but it has done phenomenally well. I was also on one of the global projects, the Global Digital Health Index, which has become a global digital health monitor now. When we started, I used to feel ashamed that my country has the best techies in the world, but where am I in that list? Right at the bottom. Look at it now. We probably are on the top. And we have the top man from the National Health Authority with us. So Dr. Basant, you lead the National Health Authority as the additional CEO. So when you look at the world's first, as I would call it, an ecosystem, for digital health, what does ecosystem mean for you as digital health, and how do you see the role of stakeholders? And I would want you to specifically mention about startups because they are the disruptors.
Right. Thank you for having me here. When we talk about the Ayushman Bharat digital mission, absolutely correct that it aims to create ecosystem. What we mean by that, we want to create an enabling environment, provide all the enablers so that private entities, startups, entrepreneurs, they can come and they can provide premium services. They can cater to the demands of the market. In this regard, we are creating digital public infrastructure. There are a few registries that we are creating. The Ayushman Bharat Health Account, a national registry for all citizens, so that citizen, being one of the biggest stakeholder in the health ecosystem, is uniquely identifiable. Similarly, doctors, nurses, all the healthcare professionals, they'll be provided with a unique HBR ID, a registry for the professionals, being the next stakeholder in the ecosystem, and a registry for the health facilities to ensure that there is a trusted source for all the facilities. Of course, there are other registries as well, such as the drug registry that we are creating. In addition to the registries, we are developing gateways, such as the Health Information Exchange, Consent Manager Gateway, for ensuring that there is interoperability of health data. Then there is the Health Claims Exchange, ensuring that there is interoperability of claims. And there is the Unified Health Interface, ensuring interoperability of services. Now, with these digital public goods, what we are trying to achieve is, maybe in the physical world, imagine that the government, the public sector lays down the roads, provides the physical infrastructure, the bridges, and it is left to the public, left to the private individuals to bring their vehicles to ply on these roads. It is almost akin to that. The digital public infrastructure that we are developing is based on the open source model. So we'll be, any entity, citizen entity, any private entity wanting to use these registries, these gateways, would have access to those, and they can then, of course, as I said earlier, they can develop premium applications for providing services in the health sector. So that is what we mean by creating an ecosystem. Government does not want to create applications. Government does not want to compete with private entities. We feel that it is best left to the startups to innovate.
Thank you. And we have a startup, Tarun. The belief and the proof is that if you look at the last 10, 20 years, I mean, if I were to even go by comparison that I have done in one book, that the oldest automobile companies are 150 years old. I had combined the valuation of all of them, all companies, and the 2003 kid Tesla. Tesla is much ahead of all the companies combined. So startups are disrupting every sector. So where do you see this disruption coming from people like you in the healthcare system in India, which we have perennial problems, but we have perennial opportunities going forward?
Yeah, thank you. I think startups in India actually for healthcare, like Sir said, healthcare is always the last. And the reason for that, I think startups to touch it was primarily two reasons. Um, Startups is in India at least have been mostly led by engineers. So engineers would find themselves long way off from the health ecosystem, right? Understanding what doctors need and how the system operates. So that was always a challenge. And the second challenge has always been that healthcare requires a lot of trust. So naturally speaking, startup which requires fast growth and for it to be a venture bet to make a disruption, all of those things, right? There is actually a very slow burn initially to create certain degree of trust and faith with patients that there can be some value created by us in startup world. So as a result of which, last 20 years, mostly I think startups try to take the easy way out. The easy way was to actually try and solve for what the government is finally stepping in and solving, which is building registries and allowing for booking of appointments. You can find a provider on the website. So very basic kind of infrastructure, which I think now, given that government will take it up, that will be really big help, because there is also validation and there is a certain degree of assurity that comes from that from the government side. I think having moved on from doing basic stuff, finally I think there was some work I think which was done by SaaS companies to bring in some efficiencies inside hospitals, so hospital management systems and lab information systems and all of that stuff. But finally, I think startups are now willing to take a bite into the actual act of providing healthcare. So, Dhruv is an example. We are now trying to do something in diagnostics. There are companies that are trying to do secondary care surgeries. We're trying to build in a certain kind of efficiency that an engineering mind can provide. And be of value and support to doctors in making things faster, easier, more accessible than what it is today. We can innovate to bring in some degrees of cost efficiencies by centralizing with new kind of tech. We are challenging some of the norms about what the healthcare ecosystem thinks that can only be done manually, cannot be done using tech. So we are kind of believers. We will always challenge that assumption and push the agenda on that a little bit. I can give examples within our own company, how we have automated some of the reporting solutions itself, how we have centralized the effort of pathologists, just like in teleradiology. We have made it possible to do telepathology in our company. So some of these innovations, are finally engineers are taking a bite at the problem. Which I think is a sign of the ecosystem growing. I think the future is going to be that how, with the new ABDM infrastructure, right, payers are going to enforce certain standards onto the ecosystem. So every health company will have to be a health tech company to a certain extent if they want to get paid, right? Because what I imagine is, as soon as the health information exchange is ready, as soon as the claims exchange is ready, payers will find an opportunity to go deeper into the market and cover more outpatient expenses, cover more inpatient expenses. More money will flow through payers, which will in turn be only possible if you, as a healthcare company, are connected into this digital infrastructure. So the healthcare companies will work, I think, more closely with these things. And because of standardization of the language of healthcare, because of this, right, a lot more automation is possible, right? With advent of AI and other things, a lot of basic processing we do, discharge summaries, identifying basic issues, creating flags for emergent cases, can just be done by technology. You don't need triaging, or you can reduce the cost of triaging by a huge extent. A lot of stuff will get automated, I think, in the future. Once the standardization kicks in, thanks to what government is bringing as a digital public good. But it'll take, I think it's still a maybe 1 or 2 decade journey, but it's going to be a very exciting one to do.
Thanks, Tarun. You said that engineers tinker, but the guy sitting next to you is a startup guy, doctor from AIMS. He still tinkered it. And what he did is very amazing. So those of you, I'm sure that those who are in health know would have heard about Cloudphysician. You know, when you are in a tier 2 town, the biggest challenge you face is, should you need an ICU bed or should you need ICU services, where do you get? You don't have specialists. So he found that as a big gap. He created Cloudphysician. It's a phenomenal thing that is available. So what has been your journey, Dhruv? You're not an engineer. So what, as a doctor, you did, the perception, what I like about startups is, it every time beats our understanding of the system. We believe something, it is totally the opposite. It's not engineers, it's doctors. You think that, it's like established companies that will disrupt. Not at all. They may not even exist. So what has been your journey and what you see as, I would like you to talk about what you did, how you did, the role of digital ecosystem, the role of the NHA, how you can support NHA initiatives. Because see, at the end of the day, government has taken the stewardship role. It's not going to do all. But if we work in a framework, we will as a country benefit, will stand to benefit. Over to you.
Yeah. Thank you, Professor Gupta. So I am a doctor and I am an ICU specialist doctor myself. And so a little bit different. I've seen engineers trying to solve healthcare problems for a long time, and maybe it is time for some doctors to actually do that themselves. And so I run a company called Cloudphysician, and we help hospitals manage their ICU patients better. People ask me, are you a health tech company, or are you a tech company, or are you a healthcare company? And I always say that we're a healthcare company. But if we don't have technology in our DNA, we won't be a company at all, right? And while that's already sort of becoming the norm, and I think in the next 5 to 10 years, that is just going to become a reality. If you're not a technology company, then you're probably not a company itself. So we are still very much a healthcare company, and the way that we look at it is that, we look at technology as the enabler. Technology is pretty much in everything that we do, but what's the problem that we're solving, right? I think that's how we've looked at it. The problem is that patients don't have the care that they need. Hospitals are not able to manage these very sick patients, ICU patients. And there are very few hospitals, traditionally the corporate hospitals or the large centers like AIIMS, etc., that are able to provide quality care to the patients that come there. How do we ensure that quality care is provided to patients no matter where they are? Because emergencies and critical care happens everywhere. People have heart attacks everywhere. People, have complications of diabetes everywhere that require them to be in an ICU. How do we ensure that irrespective of where this patient is or where this person is, they can get access to their closest community hospital and get high quality care in that community hospital, as opposed to being transferred to another hospital or to another city where they lose a lot of time that they don't have, which is very precious when you are having a heart attack or a stroke or something like that. And we realize that the answer to this is not going to be a conventional answer, right? Unfortunately, we cannot put an AIIMS in every community. We cannot put a Max or a Medanta or a Fortis or a Manipal in every community. But what we can do is we can enable the hospitals that do exist, the doctors that are running these hospitals in each of these communities, to provide the kind of care that perhaps they would ordinarily have received in a larger hospital. And that's what we are doing using technology. So what we do is we actually convert ICUs into smart ICUs, right? We digitize the entire ICU. We connect it to a central care center where you have a team of highly trained doctors and nurses who are located in large cities where they're available, who are then able to oversee the care of these patients. And they are able to reduce mortality rates, they're able to ensure better response times, they're able to actually ensure that these patients get the treatment that they need at the time that they need it, and are able to go back home to their lives and livelihoods. When a person is critically ill, there are essentially 3 complications that occur for a person that is critically ill. One is mortality. Unfortunately, they lose their life, right? Or morbidity. They have some sort of a long-lasting disability. And the third one that people don't realize is that critical illness causes poverty, right? Every time you go and get admitted into a hospital, your patients are actually using their savings to pay for their treatment. And if you get admitted into a large corporate hospital for a 5-day stay in an ICU, you are essentially sort of consigning yourself and your family to poverty. And so these are the 3 things that we need to address. We need to enable these patients to get the care that they need closer to their homes, closer to where they are, in a cost-effective manner. And you can only do it by digitizing this framework and by ensuring that this new way of technology-enabled healthcare delivery can be provided. And that is what we've been doing now across 170 hospitals, across 20 states in the country today. And most of these hospitals, 80% of them are in tier 2, tier 3, tier 4 locations. So we're enabling that those patients in those hospitals, small hospitals, medium-sized hospitals, are able to get the same outcomes as they would in an AIMS or a Manipal or whatever else it is, closer to their homes in a more cost-effective manner. Now, what can the ecosystem do to enable this? I'm really happy to hear about some of the things, and we are obviously plugged in with what the NHA is doing. But like it was pointed out, I think they're sort of laying the foundations, you know, the roads and the bridges and the railway tracks for people to actually come and build their cars and sort of build their airplanes, etc. And I think that's great, you know, the entire consent framework that's coming through that enables this. I think all of these things are really something that, you know, and I think one more thing that I would like to say is that we are seeing the payer system also mature right now, right? Whether it be the government payer, whether it be the private payer, or the traditional payer who is the patient or their family themselves, where they are sort of also want more accountability, they want more transparency, and I think that can also only come with digitization. Right? There's no other way that you can do that. At the end of the day, if you are paying for some care, you want to know you were given the standard of care that you deserve, right? Whether you are an insurance provider or whether you are, you know, the government payer or whether you are the patient's family themselves. And the only way that you can now ensure that is if you move to a more digital framework. So like I was saying earlier, I think that it is inevitable. What we're doing is sort of inevitable. It's a question of how quickly we can get there. It's great to see, you know, whether it's government or other folks in the startup space, again, create this ecosystem of change. I actually do wish that more people from the clinical domain sort of come into the more innovative part of it. I don't think we have enough. We see a lot of engineers still trying to solve healthcare problems, not enough doctors, unfortunately. It would be good for doctors also to move that. I think they can really make a big change if they do. But it's good to see the entire ecosystem move in this direction.
You know, if you really see this panel, it's very balanced. There are 2 doctors, 1 engineer, you know, 1 healthcare professional, and, you know, 1 someone who's on the policy side. So you really get a mix of that. So I think more doctors are coming. But, you know, when I look at the title of the session, Digitizing Healthcare, I always look at, you know, being an author, not an authority. I've always been on the digitalization and digital transformation. So for me, academics is very important. You know, you have one side, organizational maturity. So if you talk today, India in digital healthcare has organizational maturity, technical maturity. You know, any problem you throw at, we'll give you 10 solutions. You say ICU nahi hai, Dhruv will say I have a cloud ICU. We'll have 10 solutions for every problem. So there is a technical maturity. Technically we can solve. Where is the organizational maturity? Where are people trained? So that brings me to Mevish, you know, who runs the digital health programs. Like, what is the role that you see for academia, you know, or for programs in digital health? What's been your experience? What you would like to share with the audience?
So I would like to say there are digital health startups who are doing wonders, like Cloudphysician. But there are digital health startups who are actually not able to deliver, and they fail doing it. The reason behind is they don't understand digital health completely. So there is a need of digital health training, upscaling required for them. We have met a lot of doctors who are keen to learn digital health, but there is no structured program. So in 2019, we started developing courses for digital health. And we have started the program, postgraduate program in digital health with IIM Raipur. We have Dean of Medical Colleges, CEOs, pharma companies have nominated their employees into this course. So there is a need that we need to fill, and we would need a lot of institutions delivering upskilling programs in digital health. The experience we have seen is the average experience of 20 years joining this course. We are also launching courses for hospitals, how they can adopt technology and small hospitals can become the smart hospitals. So there is a need of digital health upskilling programs.
Thank you, Mevish. And you know, I will use the collective wisdom of the audience in the room. Most of the time, you have gems in the audience who are much more accomplished than people on the dais. And then, you know, we will get to questions. with the panel. So what I'm going to do is pick a few questions, and I want to ask one question with you. See, there has been a concerted effort from the Honorable Prime Minister. You have a wonderful additional CEO of NHA. When I met him, I found him as like, really trying to do anything possible to make digitalization happen in this country. Someone who wants to push and do anything, fire all engines. Now my question is that we have issued almost like 46 crore Aadhaar numbers or more? 50?
Yeah, it's 49.3 crores. We'll be hitting 50 crores
Yeah.
anytime
So
during the month.
yeah, I want to ask you, and this is our moment of truth, is that how many of you use Aadhaar numbers? Can you raise your hands? 1, 2, 3. So that's encouraging. And what I want you to do is, if someone can stand up and say, what exactly are you expecting from an Aadhaar number, and let's try to find you an answer. Can someone please come here and take the mic and speak? We want to understand from you as well. I mean, this is digitalization, and technology democratizes information. Please, you can come here and speak if you want to. Yeah, please, stand up and speak.
So I'm Meru Patil here. So I'm into healthcare domain. So when I was in Samsung research, I could see it. We had some of the Korean data where 10 years of longitudinal data can be fetched for a single patient. Can we find something like that? Because I will get MRI done somewhere else, X-ray somewhere else, show to some doctor. Okay, can we connect everything?
Thank you.
Yeah, so I think first I would like to, just a small reaction to what Professor Rajendra here said. He said, we are all having Aadhaar, but we don't know what to do with it. Please remember, I held on to my Aadhaar for 9 years before even knowing what I could use it for. And Aadhaar is just maybe 1.5, 2 years old. So maybe that would set it, record straight. But yes, I think what my friend there talked about is exactly what we are trying to achieve. The government's vision is to have the next generation wherein they don't have any physical health records. The next generation, right from birth, from their antenatal records, the kids they have there, from the birth record, antenatal records, all health records are digitized and are available. I keep telling people this, even when I moved to Delhi from Punjab, and my kids, they joined a school in Delhi. Every school asked for that immunization record. I could not find it. Right? And being a doctor, I knew what the National Immunization Program is, so I just filled it. Now, why don't we have this all record? Why can't we have this all digitized, available in a single health account? That is what Aadhaar aims to achieve. There are people who have started using it. There are people who are now able to fetch their records onto their personal health record application. So this behavior change of having e-prescriptions, having electronic health records, linking these records to Aadhaar, storing them in your PHR apps, and being able to share them to your prospective doctors, your treating physicians. This behavioral change is going to take time. We have the infra. As Professor Rajendra said, in India, we have the tech solutions. Of course, we need to create awareness. We need people, all the stakeholders in the system to adopt this technology. And then, of course, comes the behavior change. But we have proven with the way we have shifted to digital financial transactions, we have proven that this behavior change is possible. And I can see it happening even as I speak. The health claims exchange, introduction of a claims exchange where claims are interoperable is something which is happening as we speak. 47 insurance companies and TPAs have been able to adopt the health claims exchange. 9 of them, along with 9 hospitals, have been able to share data, share claims across the health claims exchange. So, we see that this transformation will happen. And you very rightly said, the payers will demand the providers to shift to do this technology shift. And that will happen. And then, of course, the final part would be standardization of health data, which will flow across the exchange. And I see it happening. I feel it could happen earlier than a decade, but it's a journey, and we have to take this journey together. So we are pushing for adoption of digital health, and I believe there's a technology factor to it, there's an adoption factor to it, and finally there's a behavioral change factor to it. Yeah.
Thanks. Dhruv, you are a doctor and you use a technology platform to provide a critical service that cannot be provided if you do not have the data. And live, synchronous, it's just coming online. So there are people sitting here who may think that why should I have an ABHA number, why should I use, or for that matter, any electronic health record. God forbid, I am sure that no one should think of lawyer and a doctor in life, but what you hate to have, you end up having for whatever reasons. Like today we all use our COVID vaccinations online. How critical do you think is electronic health record for people to start using? Starting with the ABHA, that's available, that's tested, done by government and then made available. And his team is putting tremendous effort. So if you were to give a message to people to start using ABHA, why they should use electronic health record, the second part of the question, do we really have 10 years time for transformation?
I think that's a great question. I spent about 7 years in the United States as a doctor, and I was there during the time when the Obamacare, etc., and they did the entire digital transformation in the United States. And as a practicing doctor who takes care of patients myself, I know the importance of knowing what the longitudinal record of a patient can help me in, right? I know how it can help me deliver a better outcome to that patient. How else are you going to do it? Currently the way that we do it is, like it was just pointed out, you're either carrying your vaccination record, which you may have lost, or some CT scan or X-ray, which we constantly, as a doctor, I constantly encounter this problem where a patient will come and say, yeah, I did it at that hospital, I don't have it, I don't know where it is, etc. These things influence the decision that as a provider you're going to make. So you may either make a decision to redo a test or redo an MRI or redo a CT scan. That is not in the interest of the patient. They are paying more money, they're getting exposed to more radiation, they're doing all of these things. That is not an ideal situation. As opposed to having a longitudinal record where I can see that 1 year ago this was what the patient's HbA1c was, or what the MRI looked like, and this is what their complaints are today, and this is what it looks like. That makes an enormous amount of difference as a provider for the outcome that can be delivered to the patient. And also, in addition, providing better care to the person themselves, providing more transparency so that they themselves are involved in their care and they can see the progression of their care getting better, or in case it's getting worse, take action on it. All of these things can actually cause an enormous amount of difference in, number one, the quality of care that's provided, number two, the cost of care. Both of these, it is going to influence them. So I think it is inevitable and we must move in this direction. I do not believe we have 10 years to do it, and hopefully with the kind of changes that are coming through from the NHA, I hope we don't have to wait for 10 years.
Thanks. In the interest, I saw divine bells ringing, so I'll have to be a little brief on that. So Tarun, I read testimonials of your people who have used your services. Timely service, they say, couldn't imagine it could be like this. So now that we have data, we have tech platforms, and AI is in healthcare. I say that digital health is there to take over, and AI is here to overtake us. That's the fact of life. You like it or not, that's the way it is. So do you think really that if they start using ABHA numbers, or for that matter, any EMR integrated with ABHA, do you think AI will be able to help them save money and their lives as well? Your experience in tech?
Yeah, the main advantage of, like I said, for using a digital health record is essentially eventually going to be the fact that that information will be codified, right? And mostly a lot of the